teach when I go into clinics, and even what I have taught with dental assistant groups that are fresh out of college and training and ready to go into the industry. And so before I get started, I just want to share with you that truly the overarching goal of tonight is to challenge the idea of clinical documentation as something bigger than just a task within the day because of what it means for the entire outcome at the end of the patient visit. And so frequently, when I go in and I have a team that asks me to do an audit of what's happening within the clinic, one of the very first things I see is missing documentation, which has a lasting impact on not just the patient experience, but also the outcomes of things such as treatment plans and the revenue that's generated. So I really do hope that your takeaway tonight is just this very kind of logical thought process of, okay, what can I do right now? And what can I do in the future to continue to improve this? So you've already got an introduction to me. I'll skip over that slide and just start here. But what I'm really have been in pursuit of because of the turnover happening within our clinics and fewer team members on board is this idea that AI is becoming this catalyst for transforming the way we think, we work, and we interact with the world around us. I want to preface by saying that my approach is not void of human interaction. Many times I see kind of this active AI learning response and people saying, we can remove the human element. I don't think dentistry will ever be dentistry without a human element. And the purpose of what I share today is to challenge that AI is this assisted response to better your teams and help them be more capable of fulfilling on aspects of patient care. So really what we're looking at is we're looking at this current patient. And if you look at the first picture and could just visualize with me for a minute, the way many of us were before COVID hit with our interaction with businesses. Maybe not in general life. Maybe you were motivated long before COVID hit. But as far as your interactions with another business before COVID, did you find yourself easily irritated if the business would mess up? Did you find yourself unforgiving of something that was less than perfect or not automated or accessible to you? And now, do you find yourself a little more impatient that businesses don't have the technology you need, or they're not on DoorDash or Grubhub for you to place your order so that you can get it delivered to your house? Are you more impatient and unaccepting of this idea that why does this business not have technology? If you can imagine that consumer for a moment, that is ultimately what we are dealing with in today's culture. It's why we're seeing a decrease in patient outcomes within the practice and patients being more fickle or willing to change practices. It's because we've gone from kind of this lackadaisical mindset in the consumer behavior of, well, they didn't get it right this time, but no worries, I've loved them forever, to a mindset now that time is money. Why can I not schedule this online? Why do I not have access to this now? So a little bit more of an unforgiving culture, which in my mind becomes the reason why we've got to up our technology and get ourselves ready to go with new methodologies and new ways of communication. So if we look at the pitfalls that we're trying to avoid in clinical documentation, now knowing what our consumer, our patient looks like, we're missing key details that are happening inside of that clinical note. There's a delay in entering information. I've gone in and worked with practices where they're not entering information for 2 to 3 days post-visit, which delays the claim, which sometimes I've had practices say there's just not enough hands to get the clinical note in. So we call the patient with their treatment plan instead. And incorrect lab scripts are generated. So seeing a greater increase in lab remakes as a result of lack of information and incorrect treatment plans. I frequently see more and more now where a dentist will make a recommendation of treatment, maybe in partnership with the hygienist after, the comprehensive exam is completed or just a routine exam. and the note never makes it into the chart correctly. So now the treatment plan, which included the crown and pen retention, is only the crown. And the doctor's frustrated because the patient's already been presented their patient portion, and now we have to go back to them and ask them for more, which you and I both know leads to that patient saying, this isn't okay. Like, you can't come back to me and ask for more money. So the solutions we're looking for, the driven response to fix these challenges, is this regular audit of our documentation process and encouraging this culture of thoroughness with an addition of AI as a supportive measure, and potentially gamifying this to make note taking something that you could reward. What can you do to make this be an active opportunity to grow your practice? And so, what you want to avoid chair side really is this unprofessional language or things that might be perceived as not what you would intend for the patient to hear from the doctor, as he or she comes into the room. And so I want to challenge this idea that if you look at your clinical notations as not just something that is a recap of the structure of the visit, post visit, and done by maybe the RDA and signed off on by the doctor, but more of a Mayo Clinic approach where we're allowing what's happening throughout the patient visit to be captured and solidified, potentially AI, which I will recommend further in this presentation. It allows us to have full documentation and ultimately protect doctor licensure along the way. I want to consider this idea with you tonight that maybe if you can get past just that templated note that's done at the end and challenge your teams into more of a Mayo Clinic approach, you likely will build a better team and better output and response because of some things that you can do along the way with scripting and clearly defining things. Sometimes in practices, we make it almost a little too difficult. And what I see happen is with, I'm mentioning factual language. Many times I will see someone coming in who is non-clinical into the clinical space and making suggestions or sharing something clinical that's really reserved for the clinical team. So tonight we're just going to build those borders and boundaries to make it a successful visit. So, illegible handwriting is another one. I still see where the team is taking notes on a notepad and making that documentation, and then someone else is translating or typing it into a note at the end of the day. I'm seeing extreme measures taken to try to avoid errors in a prescription to the lab. But at the end of the day, the handwritten note doesn't compute. So they're making choices on what type of coloration should be submitted to the lab, things of that nature that could be avoided if we weren't doing a handwritten note that was waiting on translation. Also, we want to look at your locked notation process. I want to challenge this tonight with you, this idea that if you don't have a locked note process, or you have opened up your admin rights for multiple people to be able to unlock clinical notes, you have an issue inside of your clinic with compliance, and it ultimately could set you up for some dangerous pitfalls along the way. So when we finish this course, I challenge you to go back and look at your admin rights. Do your notes automatically lock? Do you have active measures put in place so that those notes, once completed, can only be accessed by certain people after a certain period of time? Do you have a process in place that once a note locks, your team is trained on how to complete an addendum to a note if there were an error that took place? These are very important compliance issues to address within your clinic. So this is a longer slide, but it's in your handout for a reason, because I want you to consider the evaluation of your current process. If I were to come into your clinic and say to you, okay, we're going to talk about the importance of clinical notes and what they ultimately affect. But first, share with me what your current accountability plan is for notes. And you say back to me, well, my assistant captures it. She has until the end of the day to get it completed, and she stays after work to do that. And then I review them, sign off on them, and we're good to go. Okay, now I'm going to take it a step further. So you're good to go, but did you lock the note? Did you miss anything, or was anything missed because you didn't have someone that was evaluating and updating that clinical notation as the patient was actually being seen? So there's added information that you're trying to plug in at the last. Did you fully look at every single clinical note for throughout the day? And did those notes reflect actual things that happened in the patient visit? Or was it the template cut and pasted into the note template or into the note section with nothing being changed? And the reason why I ask you this is if you were to go tomorrow and look back at the last month of notes being taken, would there be evidence that your team maybe used the template but didn't fill in any information? What I have seen frequently in the last couple of months in particular is because there's a deficiency with team availability, what's taking place is the note template is being inserted, but the number of carpules used to numb the patient, the materials used are not updated. They're left standardized just like the template, and then when it's submitted to insurance, there's enough missing that it's kicked back for the errors to be reevaluated. And a non-clinical member of the team is modifying the clinical note because it is not locked. Now, you may say that doesn't happen in my practice. We have active measures. Wonderful. But I would challenge this idea of that clinical note template not being right 100% of the time. And so today is about getting you to see this idea of let's shoot for the highest level of accuracy to protect you and also end in you receiving the greatest level of revenue. Very important that you think about your process and that you also think about your accountability plan. If your team is not completing notes, frequently I will see where a team will not complete notes. I had a hygienist once that told me she would save all of her notes until Friday, and then she would stay Friday for an extra 5 to 6 hours and type out her notes for the week. I can guarantee you that there is no way that there is a full record of documentation of what took place in the visit because by Friday she doesn't remember all of what happened on Monday. This is an important piece of the equation for you to look at and evaluate because as you see the deficiencies, what I share is going to make more sense in terms of actionable steps of what's next. So maybe some of you are familiar with the SOAP note. Maybe some of you aren't. But the step one would be prior to implementation of AI is to just take a look at your templated structure now. Does it truly follow the SOAP note template? If it doesn't, I would recommend going back to this structurally because ultimately it allows you to cover your bases. Now, with implementation of AI, you can use the SOAP note, but you can use it as more of a script outline so that you're speaking chair side. So as I share this, I want you to visualize basically two ways of this being done. One, updated template structure. Someone's following it step by step and strong accountability that follows. Or two, scripted SOAP note guidelines that allow you to use something like AI Scribe and actually verbally speak chairside what's happening and have it recorded. For example, in the same way that I just went to the doctor 2 months ago and the doctor said to me, Cassie, thank you for coming in for your wellness visit. We're utilizing AI to capture your visit today. I'm going to go ahead and let you speak to the things that have happened over the last year with your health. I'm turning on the AI now to record that into your patient chart. And that way we have a strong foundation and record of what's going on. The doctor recorded it. She followed something similar to a SOAP note structure, even though it was healthcare, not just dental, right? Because this is a healthcare template. And then at the end of that, she gave me a printout of what was documented as my reasons for the visit, as well as her recommendations, all done without someone sitting and typing that note at the end of the day. This is incredibly important for you to think about because what it did for me as a patient is it immediately boosted my trust in the doctor because I was actively listened to, not just by her, but it was documented and in my patient file. So it's a permanent record that I have access to. And two, the treatment that was recommended for me felt far more in line with what I had spoken about. The challenge will be that as you are clinically presenting something chairside for treatment, that you have this adequate backup for you of all the resources and all the things you need for it to be a successful outcome and for the patient to accept treatment. So if we look at the structure of a SOAP note and what's involved in it, I want to start by sharing that S, which is it's the subjective information. Frequently, when I'm doing audits and evaluations in a clinic, I will see where things have been noted in the patient's form, but it's never been discussed. So, for instance, the patient shares that last year they had a pacemaker put in, but nothing has been documented in the patient file to share that they take a pre-med before they come in for the visit. So, subjectively, we're reviewing the patient's history and we're setting up the doctor for success. Do you have this now? Does your team adequately document it? And could they do it with AI to where they turned it on and they said, okay, we're going to go ahead in the first few minutes here and we're going to digitally record our conversation into your patient file. We're going to go over your symptoms, your feelings, anything in your mouth that's been bothering you over the last year, any changes to your health. And that begins all inside of that subjective aspect. It's giving you a place to record that information. Now, O is the objective. So this is the document and observable and measurable data. This means what I really want you to be thinking on is what's happening within the exam. So if you require blood pressure to be taken, kudos to you, first of all, but a factual based piece of information is added into that objective space that is reflective of what's currently happening inside the patient's mouth and also with their health, so that it's recorded and ready to go for when the doctor comes into the room. I recommend the S and O are always accomplished before the doctor enters into the room. I have had doctors before that literally have a prerequisite that if those two things are not accomplished, they will not come in and do the rest of the exam because it sets them up for success. It's telling them about what's going on inside of the mouth. So the assessment part, the diagnosis or impression, right? This is something where I believe that the doctor's verbal cue to the assistant or the hygienist allows for the assessment portion, to be communicated verbally and digitally recorded in the file. Again, I will recommend AI all day long. You can do this directly as well with just a notation that's been taken and placed into the patient chart, by all means. But what I want to hear, or what I want to challenge you to have happen, is that the patient hears that information. Frequently, I will go into practices where the doctor is doing diagnosis outside of the room and evaluation of the x-rays, making comments about the level of caries or what they see or, the pocketing, and then coming back into the room and having a far less, detailed conversation chairside with the assistant or hygienist. I want to challenge with you this idea to go into the room and have the conversation and pull up the x-rays together and have the full discussion. Tell me a little bit more about hurting on that lower area there. So what I'm seeing is this, and I believe that we've got a couple of different outcomes or potential diagnosis because of that. I'm saying it out loud. I'm not saying it behind the patient's back. And again, please document this. I know that there probably are some amazing seasoned providers that are on the call, but what's happening because we have fewer people and we're moving at a faster pace in the clinic is that we have forgotten that if we will sit down for this assessment piece and get eye to eye, no standing, no behind the patient's back with the chair and they can't see you. You must be sitting and at their eye level to share the assessment and findings, because it's one of the key areas to build trust with the patient. Then you outline the treatment plan. Now, right now, you may have a process for outlining the treatment plan. Maybe it's a form. Maybe you have your team member just jot it on a route slip or something of that nature. Many times I will have a doctor come back to me and say, you know what, our treatment planning process is great. We rarely have any issues with it. And my comment back is, okay, let's talk about your percent of treatment plan acceptance, but let's also do one more thing. And this is your challenge as well. How many times in a given month is an adjustment, a patient adjustment to their ledger invoice being made because of an error in treatment planning? Maybe you've never looked at this before. Maybe you've relied on your team to communicate that information with you. But I would really recommend looking at those adjustments. And here's why. Frequently, what I'm seeing, because of the deficiencies with team and overall issues with clinical notation, that this plan, this outline that's being developed, which we know in dentistry, the really great process that you have usually is to be suggestive, but suggestive of one ideal option at least, right? Which would be, for instance, a crown versus a less than ideal option, but would still get the patient through until something more could be done, perhaps, like, putting in a sedative fill, or we're going to do a 5-surface filling to give the patient an option, right? To say, this is not the ideal option. The best option for you is to crown the tooth. What I'm seeing happening currently is the doctor is making multiple recommendations for the treatment plan, even stages of care, right? Visit 1, visit 2. And what's happening in the place of presentation is elements within that are being left out. There are incredible PMS systems out there that will allow you to code group on the treatment plan side so that you can select a tooth and all of the codes become grouped in the treatment plan. But I really believe the origination of accuracy, of optimization starts with how well it's documented when you say it chairside. How frequently are you going back and having to repeat what you said to the patient because it's too complex for someone at the front desk to get it all in there? You're missing information, or they let the patient go because they just can't figure out the treatment plan. If the plan and outline is recorded in real time as you speak, it lays the foundation for everything else that follows. So you touch your earpiece and you say to the patient, let's go ahead and talk through what the treatment plan options are. The AI is assisted in recording every aspect of what you've just shared. And then you have the ability to not just have the treatment planner utilize that foundation to create and build the treatment plan for presenting, but you can also print the notes. So the incredible thing about it is when you're using that, assisted function, is I now can share with the patient both treatment plan outcomes and also oral health recommendations. It's incredibly valuable to have that second response. You could even email it to them and say, you know what, I went ahead and went over this with you, but there's some really important details about the right flosser to use, the soft bristle brush to use, and I want you to have that from today's visit. So it becomes also an educational trust transfer piece. So keeping the team accountable can happen in a multitude of ways, but do you have a timeline for note completion? And does the team know it? I'm not suggestive that everybody will cut corners, but I am suggestive of the idea that if you don't have a solid structure, it leads to a lackadaisical behavior within your team. I have doctors that say our notes better be done by the end of the workday because they're locked and there's no going back in. And so team members know they have to be accountable to the cause and get those treatment plan notes done on time. Because more and more dental graduates from dental assisting programs and beyond don't have typing skills, I'm seeing more and more the need for AI as a replacement because they just don't have that speed to be able to keep up and be accountable to the timelines that get set for them. Also, communicating the importance of thorough documentation for patient care and also legal protection. It's very important that your team understands that this is part of protection of your clinical licensure. I have been a part of doctors actually being audited, their clinical notes being audited by the state. And I'm here to tell you, if you don't have a strong structural foundation for your notes, you ultimately are setting yourself up for a chance of, major risk down the road. Not to mention the piece that you do not know is happening, but likely is if your clinical notes aren't in check. Frequently, I will have a patient, when I'm listening to calls, I will have a patient call in, and someone at the desk is retrieving that clinical note to share something with the patient. Oftentimes, I will hear someone who is at the front desk say, "Well, you know what? There's nothing in the clinical note that mentions anything about what you just said." That is ultimately downgrading and eroding all the trust that you worked to build chairside. What I say to doctors, first and foremost, from a team accountability, and I hope you will go back and implement this. And I think hygienists, you can be a voice for this as well. Anyone non-clinical within the team that is working a front desk that was not chairside to provide patient care cannot be responsive to clinical questions. That is a question for the doctor. So, if a treatment coordinator comes in to present and now suddenly there's questions about why was I diagnosed with this, the treatment planner doesn't address that. The doctor or the assistant works with the doctor to be able to be responsive to that. If AI is implemented, you can leverage the note to share that. The front desk, I have a no share policy at the front desks that I work with that if they are taking a phone call, they cannot answer a question about a clinical note whatsoever. It has to live in the back of the house. It has to be something that is answered by someone clinical. And the example that I use is, when is the last time you called into a medical office and spoke to the receptionist about the history or something about your health? It doesn't happen, right? They transfer you to the nurse of the doctor providing your care. The same is true with dental, and it sets up this standard of care that's very, very important. So implement the SOP of what is best for the way that your practice works. Make it simplified. I'm going to give you a couple of examples here. I hope that you take them and use them. What I love to see most is once the SOP is established of how the team works with that standard operating procedure, I love the doctors that say, guys, this is the way we do it. These 3 things have to be done, or these 5 things have to be done before I can come in the room and do an exam. I know you're chomping at the bit to get the next patient back for their cleaning, or I know we're running behind on time. But if you want to run on time, these are the things I require as part of our operating procedure in order for me to be in the room. And I've actually worked with doctors that have done that, that have literally left the room after noticing that it's not done. So something for consideration would be a laminated checklist that they could just use a dry erase marker and keep it on the back counter, check off the things that are required before the doctor does the exam. And at a quick glance, if you go by the room and those 3 or 4 items are not checked off, you don't stop for an exam until they're done. It's a great way to get your team on board with accountability. So leveraging technology ultimately is going to help you build that better notation. You're going to hear more about it at the end of this presentation. I hope you stay for that demo, because for me, it is truly something I'm deeply passionate about. This is a company that I went to and pursued finding because I needed a solution for team members that were just not completing clinical notes. And then you can monitor compliance through, your dashboard report that's tracking completion. Some of you have PMS systems right now that will actually show you output reports of whether or not clinical notes are completed. There are other tools that will show you dashboards if you have insurance that will show you rejection status and why. And a lot of times it's because there's a missing clinical note or a missing x-ray that's delaying payment. So also consider some regular trainings around clinical notes. I think it's one of the most undertrained, underspoken aspect of dental, but actually like the catalyst for so much of your revenue that you don't even realize. When the notation is happening and it's building patient trust, it foundationally sets up the visit for everything that follows. And if you have a strong handoff for treatment plan presentation, and that patient knows, okay, I've got to come back for A, B, C, and D, and this is what the doctor said, and there's no behavior within the clinic that almost literally looks like they're hiding information when really they just don't know, the patient's like, okay, you know what, I'll consider that, because everything that you just said is a reiteration of what the doctor told me chairside. Frequently, I will see Google reviews that straight up say, there was no price transparency, or they told me one thing and then I got a bill for something different. The reason is the clinical note wasn't reflective of the right information, so it couldn't be handed off correctly. So foster that culture of accountability. Talk about it. Talk about it in huddle. Reward it. I love the practices where I get to go back in later on after they've implemented the right systems and processes, and that handoff that I'm going to share with you in here in a little bit. I want you to think about rewarding them. You know what? Sally, one of our hygienists this month in hygiene, every single handoff was right, or 90% of them were right. Celebrate those team members. The team needs to know that they're valued and it's seen. And there's nothing better than bringing that into even morning huddles to say, hey, listen, this patient is coming in for X, Y, and Z. They have a history of this. Let's make sure we get that documented and we set the stage up for a successful visit that follows. All of that has to do with how we notate and get it ready. Also consider adding that into your reviews. If you have an office manager that's conducting reviews, make sure that there is something added into the review section where there is a literal review and grading of completion of that. Many times, like I said to you before, if it's not seen or if it's not visible that that's actually being done, like there's no plan, there's nothing outlined, right? People kind of naturally just don't do it. Well, no one really checks on it. So what does it matter if I don't get my notes done for 2 weeks? What you don't know is likely happening in your clinic is it's potentially delaying revenue coming back to you from an insurance claim and completing that visit, not to mention the fact that it's likely causing adjustments to happen that you may not even know about tied to your treatment plan. So there's a trickle down effect if the team isn't accountable to that. Offer constructive feedback. I when I first started implementing, AI and also talking to teams about how they were treatment planning, I allowed them to pick a couple of cases from the week at the end of the week and just share, okay, let's talk about the highs and low points. Like, where did you feel like you could have done better? And what did we miss in that SOAP, even if it was captured, through AI, or we wrote a note about it, like we wrote it, hand wrote that note. What was missing and what could we have done better? Highlight it, motivate them, and keep it prevalent in the conversation. So I want you to think about this building, this structure of the clinical note and what you want included. I have just given you some bullets here that are suggestive. Obviously, you as a provider know what's best, but have you ever fully evaluated it? And are you putting out fires within the clinic on things on a day-to-day basis that could be tied to that clinical note template or verbal script cue for AI that allow you to have all the relevant information? Again, many times I see where the dental and health history is fully missing. Is there a piece in that that you could add to the equation that would make it better and more accessible? This is a outline for you, a build structure to consider that likely could follow with more of a strategic approach instead of allowing an old or outdated template to suffice. Make sure that the information you have is right. If you're optimizing this process, you're pulling in the right information, you're looking now at that SOAP note. I want to challenge this idea that the then versus now is a huge piece of the equation for you as you migrate and move forward. That manual notation is likely creating a burden for your teams. I've seen dental assistants and hygienists get heavily burnt out on notes because so much of their time is being consumed with this. Patients are having more and more health history issues, so there's a lot to record. Also, that SOAP note was hard to follow. They weren't even sure, like when you're training someone new to come into your practice, sometimes your template, it's kind of outdated and antiquated, and so it's difficult for someone to know what exactly you mean. So it's time to revisit that. Also, inconsistent documentation, meaning it's not the same every time. If you will put in place a workflow and a structure and update it, revitalize it. It allows your team to suddenly have kind of this breath of fresh air, that notes aren't something to dread or worry about, but they truly understand that you can't build the rest of the patient visit until those notations are adequately created and ready to go, with that S and the O and the SOAP, right? The subjective and the objective, because it's getting it ready for what follows. So now what we're seeing fully, I'm seeing much heavier automation of tasks. I would also challenge in this optimization for you, make a quick side gold nugget note here. If you are signing consents individually, like you're doing consent 1, 2, 3, 4 in that patient visit, and it's occupying a large amount of your time, please go back and per visit type, create a title for your consents and group them into one. So for instance, a new patient comp exam would house all of the consents associated with the new patient exam. So I can scroll as a hygienist or a dental assistant and go through all 6 of those consents with the patient in one click and sign at the bottom. Where I see a lot of the headache and worry of a team is when a doctor has said, you got to sign 9 consents and then we begin the rest of the process. What we don't realize is that's a click and a pause and a moving back and then putting it into the patient file. All those steps that are involved that sometimes can take up to 15 minutes out of that visit time. Streamline your consents. Then start to streamline that SOP. You're going to capture the S and the O verbally with AI or something that's accurate to make sure that you've got that in the patient chart. And then capturing the restorative charting and periodontal charting as well. So AI allows us to do that existing restorative charting and perio, so that I don't need an extra set of hands to update the tooth chart. And you're going to learn a little bit more about that later on. And then really create this foundation that begins to minimize the errors and enhance the patient visit. So ultimately what you're doing here is you're establishing a way of greater profitability, because there's no confusion about what you have recommended for treatment and what comes next for the patient. So this is that step that I wanted to share with you, as kind of this idea that ultimately can lead to a better outcome for your practice. So let's just say that there is a preparation for the diagnosis checklist. This could likely be it. I want you to consider these buckets or these items as being established before you ever walk into the room as a provider to make the diagnosis, right? Because if these things are done, now the stage is set. The subjective and the objective information is recorded. Perio and restorative charting is documented. You have your films checked. They're ready to go, tooth by tooth check. And now all of the information is ready for the doctor to make the diagnosis. The doctor is the one getting ready to come into the room and make that diagnosis. So the question in all of this, as we talk about those steps, is how strong is your handoff? Many times I see a fumble of the baton at the point of which the assistant or the hygienist brings the doctor in. And oftentimes it's due to the fact that there's not an extra team member available to help with recording of information. The doctor's stressed out because there's not good time management from the team perspective. They're running behind. It's time for an exam. And what needs to happen is this intentional pause to get the checklist right. And just like I said, to put down a firm foundation and say, listen, until these things are ready, I can't prepare for the diagnosis. We got to spend the first 15 minutes of the visit accomplishing these tasks and using AI to record that information. Now, the preparing and the plan and presenting can literally be the reverse side of your laminated sheet. Having all these facts ready to go, getting numbers ready with your team, talking to your team about those handoff points, having the financing options ready to go and already on your sheet. It is worth looking at a printout of your treatment plan that goes to the patient. For years, I've watched doctors that just have the same treatment plan and someone new comes in and gets trained and they keep doing the same thing over and over and over again. And now suddenly they're seeing a decline in treatment acceptance. I would challenge the idea with you that that picture I showed you of the lackadaisical laying on the couch eating pizza patient compared to the one looking at their watch is ultimately what we're faced with. Your treatment plan likely needs to be reviewed. Do the numbers show clearly? And do you use a highlighter even to highlight the one number, not my before insurance, not my patient out of pocket, plus what might happen if insurance doesn't cover, just the patient out of pocket. That's the number they want to know. They want to know, how much do I have to pay? Then I want to challenge the idea that you need to make sure that you have something about financing on there as well and get it ready to go. So we're talking about laying that foundation, preparing the diagnosis, and presenting the treatment plan effectively. These action steps are fully achievable with AI if you will find yourself in a better pattern of accountability. So ultimately, these notations, if not managed correctly, are keeping us from an accurate outcome. This was an inaccuracy of dental notation study that was done. I put in here the published link to it, but they reviewed 14 dentists and they found that over 44% of those dental charts were found to be inactive. And we all know it only takes one patient for us to have some sort of a legal ramification for missing data, not to mention the fact that I actually worked in a clinic once where the doctor's recommendation for the patient was to save the tooth and go ahead with a crown. The treatment plan and the note had been mixed up with another patient, and the information put into the patient file was an extraction. The patient was set up for an extraction, and the tooth was extracted, and that was not what the doctor had recommended. These are real life scenarios because the doctor was moving so fast and taxed and stressed out and hadn't even reviewed that the clinical note and information was incorrect. So the accuracy of AI is allowing us to have that reduction of errors, specifically even for our claims. Our dental claims are being rejected because of that. Again, I can't stress this enough, but if you have not evaluated who is accountable to your clinical notes and how they lock and who can access them, you must do it within your PMS. I frequently see the billing manager or someone who's in billing modifying the patient note so that insurance will accept it. It's not acceptable for a practice at any level. That's a clinical notation of what happened chairside, so you need to have improved accuracy. Patient care, it's not just a dental practice. It is the impact of technology and expertise coming together to transform lives. For years, you have invested in, and dental has invested in, new technology because it's exciting and it's innovative. And that's been wonderful. But now we're in a different season in time where the patient is demanding those things, not just it's our idea at the clinic to implement it. The patient saying, I won't do anything less than something that's high tech. I won't accept anything that's less than what I want. And in the same vein, you likely are doing the same thing with businesses that you utilize. You're choosing businesses that are meeting you with the right technology because times have changed. So consider these things in a better system and process, allowing you to have more of a structured approach. And please bring clinical notes back into this conversation because it is so important to the outcomes for not just your patient, but for the practice as a whole and for your revenue. Dr. Kristen, are you there?
Here.
Okay.
We are ready for Q&A.
Okay.
We have a question here, and this is from a dental hygienist, and I think it's a great question. I'm going to move up, and I want to remind everybody, go ahead and post your questions for Cassie. Questions and take advantage of this brain, because she has a big brain and she has a lot of answers for you. So this is from a dental hygienist who has been given the task of the full responsibility of the clinical notes on behalf of herself and her dentist, is what I'm reading.
Okay.
What's your comment about that, Cassie?
So say that one more time. I'm looking here at the note on it. They're looking for what the time frame should be.
They're looking, the comment here is that they've been made responsible or accountable for taking the notes whenever she does the exam for her patient. Is that a reasonable request by her clinician?
So I frequently see where a doctor will ask for an RDA or an RDH to start the note. I don't think there's anything wrong with you being a part of taking the note, but that's why I mentioned at the beginning, what is the process for completion of the note? There has to be a provider signing and handing off that component, and they have to be looking at that note in conjunction with you. You can't sign for the doctor. You can't lock the note for the doctor. There needs to be a process where the doctor is actively involved in their note.
What time frame to implement with staff and patient for practices that require change?
You know, I think this is different for every practice, but what I would say truly is it depends on if you have a team that is very willing to learn. I had a team that was very interested in having new technology and process because there were so many pain points in the clinic. And we all know that when we feel that way, we get a bad test result back, we suddenly make active changes to our health, right? Like immediately we see it and we're ready for change. If your clinic feels that pain point and they already know that there's a problem with the health of the practice, they can make changes in a couple of weeks. If the team doesn't fully see it, but only a few people do, this is something very important for you to take back. Be an advocate for the change without just sharing the problem. So if you're going back and you have seen something today that you're like, I believe this needs to be implemented, go ahead and be suggestive of it, but be considerate of the idea that that time frame may be a couple of months to get everybody on board, because you're helping them to see what those errors look like and what the ultimate impact of that is.
Do you think AI notes would work in a busy open bay area, in a pediatric office, and HIPAA issues?
Yeah, so that's actually the first place that I implemented Bola was in a practice that was pediatric. And so you can consider this for your workflow, but you can do it however you choose. There were 2 closed bay side rooms where the information was shared for the S and the O. So they gathered all of the subjective and objective information quickly and verbally with an earpiece in a side bay. And there was a different team member that did that. And then they handed off to the open bay so that the information that was shared past that point was far more just like, there was neutrality to it, right? It wasn't something that was very loud. So that worked well in a pediatric office. It had 6 chairs all in an open bay, but just opening that up to also alleviate a little bit of the burden. We did stations. So there was a station for x-rays, a station for capturing the S and the O. And that's really where I first started implementing AI. So I think it's achievable, but yes, you do want to make sure you're not discussing like full-blown patient, health history in an open spot, leveraging AI.
Can your AI program integrate into our orthodontic practice management system?
It's a great question. And I would say that the team that gets ready to show the demo can probably answer that, and how it implements. Most of the AI that I see or work with in terms of data capture, even if it doesn't fully integrate, it will allow you to just do a quick Command C, Command V, and paste it into the patient file. So either way, it's still better than handwriting a note.
Does the earpiece also capture the patient conversation?
It sure can. So you have an option for that. And I am a huge advocate of doing that because it holds the patient accountable as well. I think sometimes we forget they're a part of the conversation, and we walk in and we're like, oh, we're going to tell them all this information. It's really important to capture what they just said before all of that happened. They probably have told you that they overdrink Mountain Dew every day, that they're eating sticky taffy, and that they don't floss their teeth. Let them speak that into the patient record, right? So it becomes a shared outcome. If you
Sure.
Yeah, if you let them capture it, now it's a shared outcome as well to say, listen, I heard you say these are the oral habits and behavioral habits that you need to change in order to have a healthy mouth. Let's work on that together.
Would you recommend having a hygiene note and a dentist note for every patient a hygienist sees?
Honestly, I say that there's a twofold approach to this, and you can call it a hygienist note if you would like. I call it a foundational note and a finish note. And so what I like to see, and again, a provider needs to be the determination factor in this. The dentist needs to have the final say, but be suggestive of the idea that the hygienist completes a foundational SOP of what's being seen without diagnosis, right? Because the diagnosis is from the doctor, but is capturing the relevant data points that are all foundational, could be AI. Also, the hygienist can use the AI for perio charting and restorative charting. And then when the doctor comes in, the doctor could do their own. You're going to see Scribe at the end of this that does kind of like a breakdown of the patient visit. I see it being twofold. To get it to be adopted in the practice, I have seen where the hygienist versus the final note would be kind of overridden, and the doctor would be like, no, I don't want two notes. But doing it in a way that's like foundational capture, when you saw that slide that I had, preparation for the diagnosis, that's what that is. You're creating preparation for the diagnosis for the doctor.
Do you see a lot of technology issues when integrating AI notes?
I really don't. I'm sure that the demo team could speak to something. What I see as the greatest challenge is adoption by the team, because it's just something different. When they fully realize that this is taking and alleviating the burden from them, it's wildly successful and implemented very easily. I don't think that AI creates a lot of barriers. If anything, it's just creating a voice dictation of what you said and then grouping it accordingly.
Question from me, Cassie. Have you been involved in practices that have undergone an audit with their dental board or with some sort of regulatory agency that has implemented AI versus those that haven't? What would the benefits be of AI?
Yeah, so I actually have gone through that with a practice that we had just partially begun to implement AI, and so there was some historical notation that was missing that. And the first thing that we found out together was that the notes were never locked. So the team was able to edit them for years past the time that the note was taken. And right away, I will just tell you that was a huge red flag moment of, we don't want notes ever being edited after the patient leaves the practice. But the accuracy achieved with AI provides such protection and coverage for the provider, because now it's everything that I said, even right down to documentation of at-home care or follow-up. Like if there's a failed bridge, right? The patient says, well, no, I was never taught how to take care of that bridge, or that I needed to floss underneath it. That was negligent of the doctor. That AI capturing even those post-operative steps is critical in nature, and many times missed, where you're handing them a piece of paper with post-op instructions, and yet there's nothing physically referenced in the patient file that you ever did it. So in a court of law, if I give you post-op instructions, but it's not there, clearly we're going to have the patient side being taken 100%. So.
I would even go on to say, if you're a new graduate out there and you're looking to associate with a practice, I would actively seek out a practice using AI, because I have been witness to quite a few audits, that I've been involved in, And one that I had to be involved in on my own where a practice, actually it was a public health agency in another state, that misbilled using all of my provider information. And so, and I had to report that, and they had to pay back $500,000 to their state. These are real stories.
That's right.
And if you think it's not going to touch you, I never in a million days thought it would touch me. My experience, though, I was able to go in and see where the deficiencies were because I used to be a practice management consultant.
Right.
You associates just graduating, you don't even know sometimes how your license is being used. So make sure, I would actively be seeking out practices that are using the technology. If you have that luxury, ask them how they approach all of their documentation. We have 2 more minutes. We have a couple more questions.
Sure.
Can an AI transcript be falsified?
Yeah, so this is very important. You need to make sure that you have your sign-on and that you are logging or have an auto log out of your sign-on on the PMS system. I have seen where many times the practice is set up to where there's no log out on the system. Like, so I typed a note, but then I walked away and my computer stays active for the rest of the day. You need to make sure from a coverage standpoint of yourself that you are actively going back to your clinic and saying, hey, listen, there's something wrong. We need IT involved. But the minute I am stepping away from my computer, I have a 1-minute inactive log out. And that's critical. So you need to be covering yourself because yes, someone could do something under your own audit trail and you don't want that.
Question from Lori, is it difficult to find information in the notes taken by AI? It seems that it would be pages of reading to find an item discussed.
Yeah, so the great thing about what you're going to see with Scribe is it's capturing and sorting from a SOAP note template. So it's not just reading like, if you were to try and chat GPT, right, and just voice record and then chat GPT just like lists it all out. That's not what it's doing. It's actually learning from what you've shared and it's grouping it based on the SOAP note template so that at a quick glance, you can see what you're still missing that needs to be recorded and also categorically what's already been covered.
Does AI red flag documents for the dental team so corrections can be made? Is AI smarter than the dental team?
Yeah, so it does red flag what's missed. So you can see it in there. And that's awesome because now you can go back and see the missing data points. And I love that because remember what I said about learning with your team about, how to get them involved. One of the coolest things you can do with that AI is to use that as a learning opportunity and say, hey, we're just going to and make them sweat a little bit in morning huddle. Hey, we're going to go and pull 3 clinical notes together and we're going to see how those clinical notes turned out. And then when there's one that's just like a, rock star note, celebrate that team member for that. But it is a great way to keep them on their toes.
There's the code on the screen. We've got a couple more questions here while we leave that up for a minute. What about a security breach? The data is stored in the cloud. Is it vulnerable?
Say that again.
What about a security breach?
Yeah.
Since the data is stored in the cloud, is it vulnerable to a data breach?
Yeah, so the data is stored in the cloud within your PMS system, but from what I understand with the AI technology, Bola, it's not storing that data at this point. So it's not capturing information and storing it in a cloud-based system. It's just a real-time capture and data transfer into your PMS.
Can AI implement the voice notes into a preset auto note?
So it does. They've already got a preset note. They'll be able to share a little bit more about that in the demo, more than I can. But yes, it is a preset template.
Okay. And does AI integrate with Dentrix Ascend? I'm sure they'll get into that during the demo.
Yeah, I'm pretty sure
Okay.
I would definitely ask.
All right, everyone. So on the screen is the passcode 616391. The link is also in the chat area. It's in your handouts. I want to thank Cassie again for a tremendous presentation. It was a lot of fun I learned some things this evening, so I'm always happy about that too. But this is recorded this evening. You'll get a notification. You can share it with your staff. If you tap on the blue banner at the top of the screen, you can book a demo with Bola as well. And in just 1 minute, we're going to bring up the team from Bola. They're going to give you a demo, Tina and Jessica. And let's see, what other notes do we have here? Lots of thank yous here. Rhonda wants to know the percentage question answers in the quiz. Are they shown on the slides somewhere?
Yeah, let's see. I'll let them start the demo and let me look that up and I'll tell you the information.
Okay, sounds good.
Yep.
All right, so 616391 is the quiz code. We will put that in the chat area too. And in the meantime, we're going to bring up a demo from Bola AI, and I know all of you have been waiting for this. And to book your demo, you can tap on that blue banner at the top of the screen, enter your information. Cassie, do you want to go ahead and introduce Jessica?
Yeah, absolutely. So I've had the pleasure of getting to know Jessica over the last year, and just is this incredible, brilliant mind who has come to Bola with just this background and love for, clear communication and best practices for dental offices. She has a history in dental, so she's not just speaking to you as a salesperson. She has lived and breathed in this space. In fact, her exact words to me not that long ago were she misses being in the dental office. So you're a tried and true dental junkie if you say that, because it's not easy work to work in a dental practice, but just incredible to have her here to introduce Bola and share more about everything.
Thank you, Cassie. Appreciate that introduction. Like Cassie said, I come from dental. I actually used to be an office manager. And so I'm incredibly passionate about, of course, Bola, but creating efficiencies in the workplace and in the dental community, right? So that we can give back to those patients and give more face time. I started with Bola about a year ago. And we have, since incorporated Bola into thousands of practices and growing quite rapidly. Sorry here. I wanted to also kind of share what our goal is. It all comes back to the patient, right? So with our voice-enabled AI technology, we're essentially wanting to free up admin tasks so that the providers can focus on what matters most and what they do best, which is patient care. So everything all goes back to the patient, right? And then with Bola, we offer 3 different solutions depending on your practice management system. But it all comes together as a very comprehensive AI suite and workflow. So our first solution that we started with is our voice perio solution. So it gives you the ability to utilize our AI and voice technology to capture your voice and fill out your perio chart in real time. This negates having to grab an assistant or wait for them or go from the patient's mouth back to the computer. Again, we're reducing time it takes to document while also increasing accuracy, right? Because you're capturing it easier and hands-free. And then we're giving more face-to-face time back to that patient as well. Our next solution is our voice restorative solution. So like perio, utilizing voice to chart existing restorations and future treatment. Very, very helpful for new patient exams. It often takes many clicks and navigation in your PMS to put in existing codes. And so this gives you the ability, again, to use your voice to capture all that in real time. And then lastly, and what is very, very new, is our AI scribe. This is what Cassie focused on a lot. And again, it gives you the ability to utilize your voice for dictation. And then our AI will take a transcription of your voice and then transfer that into a couple different formats. So you have the option of what kind of output method you want to achieve with your clinical note. A few of the key efficiencies, just to, again, name a few with Bola. Again, hands-free charting. So you're gonna be able to document your findings and treatments without interrupting your workflow, which is incredibly important to have consistency of care, reducing time of appointments, and also real-time documentation, right? So charting and note-taking can be done in real time, right as a provider speaks, which is going to avoid delays and going to ensure that all records and documentation are updated in real time and not left to do later. It's going to enhance your accuracy by utilizing AI. You're going to reduce the risks of errors, and then a better patient experience, which is, in my eyes, most important, right? So with the voice charting, you as providers can spend more time engaging with your patients. So we all want to turn it back and give it, all that time back and attention to the patients. I'm going to turn this time over to my coworker, Tina. She's one of our account managers. She's fantastic. She's actually a registered hygienist herself, and she is going to showcase Bola and give you some visuals of what it would look like into your practice management system.
Thanks, Jessica. So hi, I'm Tina, and I've been working here at Bola for about 5 years. And I'm going to show you all 3 of these solutions. I'm going to start with Perio. So let me just share my screen. And we're going to do it in Dentrix Ascend. So this is what Bola looks like when it's loaded onto your workstations. Very discreet here. You can just click on the microphone. This will chart with voice all of the conditions that you would have in a complete perio chart, meaning pocket depths, bleeding sites, gingival margin, mobility, furcations, separation. You can mark it all with voice. I'm only going to show you a few things tonight because of time. So let's take a look at how this works. It's very flexible to the clinician's commands. We don't have you memorize commands or anything like that. So it's really how you want to use it. So 323, 323, 323, 212, 212, 212, 111, 111, bleeding on the mesial of 1, bleeding on the distal of 2, start recession, 333, 222, 111. Jump to tooth number 7, 010. Start pocket depths, 121, 212. Furcation grade 2 on tooth number 2 buccal. Mobility +3 on tooth number 3. So you can do all of your conditions just using voice, and it's pretty zippy. It goes right along, and we're happy to show you a more in detail demo if you'd like. Any questions on this part? This is our built-in patient education tool, really powerful for the patients. Jessica was talking about the patient experience. They really do want the next level technology. They want to see that you're using AI. This will create an AI generated summary for the patient. That's kind of my cup of tea, is the patient education portion, because patients don't accept things that they don't really understand. So super important for that. You can also, any questions about that part? Okay, perfect. I'm going to move on to the charting. Really hard to do. I mean, I worked clinically for 15 years, really hard to do the new patient intake by yourself, especially if it's a complicated case with multiple older restorations. This makes it really easy. You just tell it, you voice activate, and you tell it what you want to mark and where. So what this looks like, say if this was my new patient, I would start at the very beginning. Mark 1, 16, 17, and 32 missing. Add a crown on tooth 2. Add a composite resin on tooth 3, MO. Add a root canal on tooth 4. Add a crown on tooth 4. Add a direct veneer on tooth 5. Add a watch on tooth 6. Start treatment plan. Add a crown on tooth 8. Add a root canal on tooth 9. Add a crown on tooth 9. Add a direct veneer on tooth 10. Add a composite resin filling on tooth 14 MOD. So you can see how this would help me streamline things and get things in as I see them for the doctor to have all of this information before he even steps into my room. So he's coming in with a lot more information right off the bat. Any questions about this part? Okay, perfect. So now I'm going to move to Scribe. This is our latest release. A couple of different ways to do this. You can do a quick note or a SOAP note, a procedure note, or an exam note. And if you hover over it, tells you the differences of what each note does. Again, we're going to just demonstrate a couple of them so that you can see how we do this. Patient presents with pain on the upper right. Took one periapical x-ray and one bite wing on the right side. Significant swelling adjacent to tooth number 2. Doctor examined the area, feels there is an infection on the root of tooth number 2. Recommended to replace the existing fractured amalgam and prep for a crown. So you can see that you can move right along, and then you just tell it to generate the note, and it says that it's generating an awesome note. This would be for your quick details, things that you might forget if you put that note off until before you go to lunch or before you go home. Patient's traveling and needs certain scheduling accommodations or what have you. You can also do a SOAP note. And I'm going to draw your attention to this map over here. This is what we call the clinical map. So it's going to check things off for me. I'm not really worried about this that's going in here right now, because at the end, when I generate the note, you'll see that it's going to clean this note up and it's going to file everything in its appropriate section of the note. So patient presents with pain on the upper right, took one periapical x-ray and one bite ring on the right-hand side. Patient reports that the pain has been for about 1 week. No change in lifestyle. Blood pressure is 120/80. Heart rate was normal. Intraoral examination shows swelling at the gingival margin on tooth number 2. Doctor came in to do the diagnosis. He feels that a crown is needed on tooth number 2 to replace a non-serviceable old restoration. Next visit is going to be in 1 week. Patient is traveling for the next 3 weeks and would like to have this resolved before his trip. So you can see that as I went, it checked off all of these items. Now I'm going to tell it to generate the note. And it's going to put everything in its proper place in the note so that we have everything that we need. And like Cassie alluded to, nothing lives here, nothing lives in Bola. So we copy it and we put it into the practice management software. Any questions about this part?
We have some questions here, Jessica. Go ahead and bring them up. And I do want to remind everybody too, at the top of the screen, you can learn how to book a demo with Bola as well, or that link is also in the chat area. Question about what model are you using?
I'm sorry, what model, what language model?
Yes, apparently.
I'm not an engineer, I'm a hygienist, so I will answer this as best I can. From what I understand, it is a blend of 3 different AI models, and I don't know which ones those are, but I'd be happy to find out for you.
Does Bola integrate with SoftDent?
Not our Peria or restorative at this time, but our scribe tool will work with any practice management system. Again, we make it very easy for you just to copy and paste. So it's compatible with any system at this time.
Comment, this is everything I've been asking for. Voice to text has been available for so long that I was surprised to hear that it hasn't really been implemented into dental hygiene yet. This is so exciting, revolutionary to the dental field. Little known fact for most of you, because you're much younger than I am. Early on, there was a voice activated probe when I graduated from UCSF back in 1990, but you had to speak with an Alabama accent. Now, I'm from Pittsburgh, Pennsylvania, so I had to really change I had to say number, 555 on number 3, and then it would pick it up. So it had to voice train me, not the other way around. So it never really took off. So anyways, just thought I'd let you know.
That's funny you say that. I'm from Alabama.
Oh, really?
Our AI is built to actually interpret and decipher many different accents. So you don't have to train it, right? It's plug and play, ready to go. I actually came from medical scribe, Gabrielle. So like you, I'm very excited to start bringing this to the dental community because, it's something that we really, really need. It's making a difference. So I'm excited that you are.
Comment about Adriana. Thank you for the demo. I'll be talking to my dentist and office manager about hopefully getting this into our office. AI can pick up foreign accents as well.
Yes.
Yep, and Pittsburgh is definitely a foreign accent at times. I know that. Any other questions here for either of our experts? Another comment, great, you don't have to touch anything. Love the voice perio charting. What is their next step once they book a demo with you? What can they expect?
Yeah, so I'm on the sales side of things, and I'll be the one getting on to a Google Meet and doing a more in depth of what Tina gave today, going through each of our solutions and what your current workflow is, and then how we'll be able to fit in and enhance that, and then go from there.
Can you give any clues on initiating the practice in terms of cost?
Absolutely. Yeah. So that would, of course, range depending on which solution or solutions that you implement. Again, we have those 3 solutions. So we have like a bundle discount deal or individual standalone pricing. It will range between about $150 to $300.
Okay.
Per month.
And per month. Okay. And then does the scribe note taking work with preset notes?
We do have some preset notes in here. Let me just show this to you. We do have like some basic ones like a crown note, a filling note, but you wouldn't bring your template in. But what you
not at this time, but like Tina said, we have specific procedure dynamic templates that give you the ability to fill out different placeholders. And Tina will share a screen and give you some visuals, but it makes it very, very easy to finish a procedure that's specific.
Right. So if I wanted to do a soap note and I wanted to say this was my template, and we go in here. It's not going to let me do this. Okay. And I would just paste it. So let me pause it. And then I would generate my note. And it will put it in all the correct spots. So you could bring your template, copy it, and then you can click where you want to add things or click where you want to overwrite things.
Tina, do you want to showcase the patient summary? That is actually...
Yes, this is kind of a very cool feature because, you know, we get very used to speaking in clinical terms to one another, but the patients are just kind of like a tennis match watching us go back and forth. So the patient summary summarizes the visit and what was talked about and what was recommended in layman's terms so that they can, you know, further understand. You know, without understanding and acceptance, you know, they're not going to do the treatment. So we need to really make sure that they're well informed, and that I would definitely print this for the patient so that they could take it with them, look at it, think about it, and then they're making a more informed decision, and hopefully they're making the decision to do what treatment is recommended. So love, love, love the patient summary.
Any other questions? Let's see, is this being used in dental schools? Yes, we're actually in a few different dental schools. Tina, do you have any more details on that, on which or how many? I know that we are in some.
I don't know how many dental schools that we are in, but we would definitely be open to speaking with them because I think, you know, technology is kind of light in school. They make you do a lot of things, you know, the old way and the new way. They make you learn how to do the notes on paper and then bring in the Dentrix Ascends and the Eaglesofts and such, and they kind of give you a little bit of introduction. And I think if you're coming into this world in dentistry where it's about to change massively with AI, it'd be great to go into some dental schools and really at least just show people like this is what's out there to help you, because we collect a lot of information, so we do need a little bit of help to get it all in there.
About how many offices are using Bola AI?
I think we're about 4,000 and counting. We're growing very rapidly, especially now that we have built our scribe tool. It's been a very high in demand, so we're taking off.
I'm sorry. Go ahead, Tina.
No, I was just saying, yeah, it's been exciting to watch it grow.
Does it integrate with Curve Hero?
It does. Yes, we love Curve. All three products or solutions integrate with Curve.
Any more questions? And again, make sure that you book a demo with Bola AI, and you can do that by tapping on that blue banner at the top of the screen or the link that we have for you in the chat area. What about Open Dental?
Yes. Yep. Open Dental. Absolutely.
From Gabrielle, I only learned paper notes and documentation in school, so the templates are new for me, but this would be so much easier.
Absolutely.
Absolutely. And think of your new staff. Like sometimes the assistants, you know, they're either fresh out of school or they don't have dental experience and they really don't know these dental softwares. And if they bring in voice, they don't really need to. They can just speak to the computer and document what they need to document without, you know, having to know those codes, like especially with the treatment planning and charting the existing.
Looking here for any more questions. All right. We have an opportunity here to greatly improve your dental practices and your patient outcomes, make everybody happy, especially your patients, because they're going to see more satisfaction knowing that you're going the extra mile to make sure that you are transcribing all of their notes so they know that you know who they are the next time they come in the door. What is the fee for usage per month again, and number of users?
So at this time, we don't have a limit per users. We just charge by location, which is nice. If you grow, it of course will range between about like 150 to 300, depending upon the solutions you implement.
Beverly, the percentages were entered into the chat area for you. I'll repost those. Cassie went ahead and posted those. All right, any other questions or comments before we close this evening? I want to thank Jessica and Tina and Cassie, wherever she is, for being here this evening. An excellent presentation. I'm super excited about AI. I know you all are too. Please reach out to Bola and have them assist you in implementing this. I'm shocked by how reasonably priced this is. I really am.
When I first joined, I was like, that's it. I mean, if you think about, adding more assistants to your team or having inaccurate claims and charting, I mean, this is a no-brainer. It really is.
It is. I mean, the way the technology has advanced over the last 30 years since I've been in dentistry, I can tell you in 1990, when I bought my first intraoral camera, it was the size of Texas. I probably paid $15,000 for it.
Yeah.
And you had to wheel it on this big heavy cart with its own server and everything. And what happened? It got parked. We didn't use it, right? Because it was such a pain to drag around. Here you have something that's going to make your practice enormously more efficient, improve patient satisfaction, and really, it's less than a Starbucks bill a month for your practice, I think. So I would be doing it. I would